Hi, I'm Irma Botvin. I'm here with Dr. Larry Berkelhammer. Dr. Berkelhammer has researched mindfulness practices to increase mastery in well-being. Something on your website intrigued me, and that is gratitude, but the word before it is practice, so practicing gratitude. Can you talk about that?
So again, these epidemiological studies that I had reviewed in peer-reviewed journals, one of the attributes of the healthiest, happiest people, the people who lived lives with mastery and well-being, was they were people who tended to experience a lot of gratitude. People who go through their day always complaining, nothing is right, tend to be less healthy. They live with higher levels of emotional distress. So I thought, well, can we practice it? Well, lo and behold, there are researchers like Robert Emmons, Sonia Lyubomirsky, who recommend doing that very thing. Develop a formal gratitude practice. And they've done studies on this, where they've had people who keep gratitude journals, who express gratitude, and practicing it seems to improve health outcomes. It's fascinating. I haven't had a gratitude journal. What I've done is I've had a nightly review of my daily accomplishments during the day and what I felt grateful for. And something else I do that I highly recommend, when you get up in the morning, before you start your day, think of your plans for the day, your schedule for the day, and think of what you're grateful for. People, situations, for which you feel gratitude. That's a formal gratitude practice. Setting an intention throughout the day too, to feel gratitude. Look for opportunities throughout the day to experience gratitude and to show gratitude. They found that the people who expressed gratitude to others had healthier relationships. I mean, it's nice being around people who are genuinely, not artificially, but people who are genuinely grateful.
Is it related or the same thing to be appreciative, to really notice when you appreciate something?
Yeah, same thing.
Yeah.
Gratitude, appreciation. I think it's the same thing.
Because sometimes that word, I can take in more the idea of appreciating something than being grateful.
Yeah.
Yeah.
Gratitude seems to be the word that's used in the psychology studies. I recommend too, again with mindfulness, to throughout the day set an intention to notice when you take people for granted, when you take situations for granted. You know, it's so amazing, you know, how easy it is to just take people for granted, to take situations for granted. So I recommend setting an intention to do that. You can feel grateful even for the life-saving opportunity to have an unpleasant, invasive medical procedure. In one of my PowerPoint slides, when I present to people, I have a PowerPoint slide where I have a man sitting at a lunch counter, and the caption, he's looking at a menu, and the caption is, "I'll have a colonoscopy, please." Again, where he's choosing to have that. The idea is to be grateful for that technology exists, that test exists. Be grateful that we live in an age where we have this.
Yeah. Okay. Well, I'm grateful for the opportunity to hear your ideas about gratitude. I appreciate that.
Well, I'm grateful to have had this opportunity.
Okay. Great. Thanks.
Thank you.